Hi everybody, thank you for joining me again. It's Dr. Anjana Bhana here, back in our practice kitchen because the lighting is really interesting here and we enjoy shooting in here. And I know I've done a video on botulinum toxin and I'm going to do another one now. It's not going to be our last one because this treatment is the biggest non-surgical treatment still in the world. So most of the non-surgical treatments that are done, injectable treatments, is this. So these anti-wrinkle injections, botulinum toxin, and all the cool things that it can be used for. So here I've got like a whole lot of different bottles, I'll show you a bit later, of toxin. And in our country, in South Africa, we have these two that we use, and then I do have this one, but I don't, this was the only bottle I've ever injected. Someone brought it back with them. It was a medical person that brought it back and asked me to inject them, and these are not interchangeable, but this one has no complexing proteins. It's made from a different Clostridium bacteria, but we don't have this. The thing with this one is that you don't have to store it in the fridge. These two you do have to store. And the interesting thing is that it's not interchangeable. So we calculate these things in units. So these toxin units here, these Allergan units, are not the same as these Ipsen units. So these are called Spaywood units. And there's more toxin per volume in this when diluted, but when you count it, about 2.5 or 3 units of this is equal to 1 unit of this. Trust me, doctors all over the world, when they have to convert these units, are always at like, and have to look it up. So it's nice that I like using both of them. So if you can get familiar with both of them as an aesthetic practitioner, I'd advise it, or just get familiar with one, do one really well, and then learn the others so you have some options. And you know what's been happening worldwide now post-lockdown, and it's in a lot of our forums, local as well as international, that people are saying that their patients don't seem to be responding as well as they used to the toxin. So they're like, could it be the vaccine? Could it be COVID, stress, cortisol? Or one of the theories was that with mask wearing, and most of the toxin is done in the upper face, there's lots of expression, dosages are a bit different, we might be underdosing. It's been reported to the companies and they've analyzed their batches. Everything is as perfect as, well, they say everything's as perfect as it was before. So what could the reason be? And someone said maybe people are just way more preoccupied with themselves. So we don't know the reasoning, and is it real? Is it really a thing that's happening? So far we haven't had many issues personally. There's been 1 or 2 people that have mentioned that they don't think their toxin has lasted like what it used to, but also it's mostly the case if you haven't done it for a long time. So with all these prolonged lockdowns, you haven't been for your treatments, and you may find that your muscles are stronger, or that you just don't respond as well as you used to. It's also a drug. So as I say, it's not an exact science, but you know, it's been studied quite a bit, and we do hundreds of courses on this. We tweak our methods all the time, and we continuously read up to get the best results for our patients. So if you have been having a concern with your toxin, it'll be great if you comment down below. I'd love to hear it, and your experience as well. But you know, the thing with, say, this one, that the upper face, so how much of this toxin do you need? So this is a 100 unit vial, this is a 50 unit vial of this particular toxin, and the orange lid one is 200 units. And you think, why would I use a whole vial of this? Actually, the FDA approved units for the top of the face, so for your forehead, for your frown, and for your, like, the crow's feet, the area around, this is like without the lower face and the neck and all of that, 64 units. That's already more than this. So that's the FDA approved amount, and that's the recommended amount. And most people in this area probably wouldn't do that full 20 units, but it just shows you how much of the stuff you need to have a good and effective treatment, and that's really important. And just a quick thing, and I've seen it, that I'd like to mention it because I've seen it like throughout the weeks before this video, is the misconception about treating the forehead. So a lot of people want a lift, like an eyebrow lift, and they often say they were injected in their forehead, or they feel like they need to be injected in this area here. So if you lift your forehead, this muscle, I don't know if I'm lifting my forehead because I have toxin as well, so I don't know if you can see my forehead lifting, but it should be a little bit. So if you lift your forehead, this part of the forehead muscle lifts the upper face. So closer to the hairline, that part actually brings the hairline down. So if you go up here with the toxin, you kind of like lift the hairline, which is nice. But please remember that if you're going down here with the toxin, you are relaxing the muscle, which means you're relaxing the ability of the forehead or the upper face to move up. That creates heaviness in the eyebrows. That's why it's never a good idea to do that as a standalone treatment, even though it may be deemed like the cheapest one to treat because the muscle is thin. You might not need that whole 20 units. It shouldn't be done, and it shouldn't be like a lot of people think it'll lift the brows. It actually lowers the brows in whether it's in isolation or treated with this middle part, which is the frown. So the frown is 3 to 5 big powerful muscles for the upper face, and they move the eyebrows and the eyes down and in. So they give you a worried look, a cross look, an angry sort of look, a contemplative look. You don't want to look that way. A lot of pleasant people look upset, but they are not, because they are frowning so much. And it's very uplifting to relax that muscle. You have a very open-eyed look. You feel more confident yourself. So if you're going to want to treat the forehead, I'd advise to also treat the frown lines, but it's best, you see your practitioner and you get advice from them. So just as a thing, injecting the forehead does not lift your brows. So that's a big misconception, and I don't know why it came about. Around the eyes, you also have to be careful when injecting, because you don't want to look soulless or dead inside with over injections. And if you over inject, you can make the area look way more hollow, interfere with the lymphatic pump. But it's also a really nice area to inject because it's bringing that area down and in. It's a muscle of descent. And if you inject underneath the brow, which is that muscle that goes around the eye, that's where you would get your eyebrow lift, the tail of the brow. There's also other places to inject your toxin. So in the lower face, for like that smile frown, as they call it, the chin, the neck, we inject people here in the jawline because of pain in the shoulders. So there's loads and loads of different applications for this. And mesotox is very popular in my practice, where we hyperdilute it, maybe mix it with a skin booster and inject it into the skin, and it tightens the skin. So that's like toxin for you. So yeah, I just wanted to go over that. And there's another misconception that I'd like to quash. And we often get like, as doctors, we'll talk and we'll say, what is the 6-month thing? Because sometimes patients may, and I'll delve, it's like a deep topic, so I'll have to have a separate video for this, and it's a lot of like science nitty gritty. So how long does toxin last, and what the conception, like preconception, is like, how long should you look a certain way? And sometimes people are told 6 months, and it's not really the case. So we usually send our patients reminders in 3 or 4 months. That's when it's nice to start retreating, and when most of the movement is back. But the most amazing look of the toxin you'll get is 2 to 4 weeks after it's done. From then, you like start growing new nerve roots, you start releasing your acetylcholine, I'll explain this now, and then your face starts to move. So you are not frozen for 12 weeks, and you're not frozen for 6 months. You might have that effect with like repeated treatments where it takes longer and longer to get that movement. But by 8 weeks, you do have some movement. You aren't making as much of the lines permanently, but there is definitely movement. So you won't be frozen for that long. And also, it depends on your patient factors. Some people, it just wears off a little bit faster. So what happens is the toxin binds to the nerve, and it blocks the acetylcholine. This is a simplified version of it, but it blocks this acetylcholine, which is a chemical that makes the muscle move. So the nerve is blocked, and when your muscle starts moving again, it's growing new nerve roots and it's secreting new acetylcholine. So it's an intrinsic thing when it starts moving. Also, if there's a high dose, and in some places like here, you can't put loads and loads of toxin, you might get like a droop. So that area often comes back first. This area takes a bit of time. So that's just like to clear up that misconception, but I'll do another video on how Botox, I said the word, sorry, botulinum toxin actually works at the neuromuscular junction. But these are all our cool toxins, and thank you for joining me for this super short toxin video. If you have any questions down below, please comment, and if they're clinical or things I have to diagnose that I unfortunately do, the best is to go consult your aesthetic doctor, have a face-to-face, and that way you'll probably get better results and safer results. Besides commenting down below, if you enjoyed what I was saying, please like, share, and subscribe. Thanks so much for joining me. Bye.